Hello, this is Resource of the Week with SolanoConnex, Mental Health, Service Access, and You. My name is Valentina Kelly.
And I'm Elena Starr. And this week, we're very excited to have Dr. Norma Rodriguez de Lisenko, Chief Executive Officer for Innovative Health Solutions. Welcome, Norma.
Thank you so much. Thank you for having me. This is a pleasure.
We're really excited to learn more about Innovative Health Solutions. Could you tell us a little bit about your organization, what you do?
Yes, so Innovative Health Solutions, our mission is basically to play a leadership role in connecting public and private organizations. That way we can create some collective impact around policy systems and environmental changes in our communities. Our vision is basically to work towards a more healthy and equitable community for all populations in all communities. So that's pretty much in a nutshell what we do.
And who has access to these services that you provide?
So because we work in a partnership model, most of our services are basically infused into our partners, which we have a long list of partners that we work with. So for example, one of our programs is Everybody Loves Line Dancing. And so it's a program that we have infused to increase physical activity for our older adult population. And so we infuse this program into our senior centers, community centers, and low-income senior sites. So we don't provide direct services per se through our program or our organization. We work as partners in collaboration with other organizations who have already a distribution list, for example, for participants that come to obtain services. Like I said, like senior centers, they already have a population coming to them. So we just provide services there. So to answer your question, anybody who is connected to our community partners can access our services.
No, that's great. And it sounds like, so you guys, because your whole goal is to help reach out to different populations, right? In terms of just like health in general, or is it like a specific type of health, like mental health, or what does that look like, your reach?
So just a little bit of background with Innovative Health Solutions. When we started about 12 years ago, we were specifically set up to provide nutrition education programming for school district. Back in those days, we were called Healthy Cooking with Kids. And that's basically what we do. We taught cooking in elementary schools, after school programs. That program was such a great, had a great success that our programming had to expand. And so now we provide programming for all different ages. We provide it for families, for children, for students, for adults, for older adults. So nutrition education was our foundation back in the day. Our, I think, strategic goal was to end childhood obesity. As you see with our new mission now, is more broader. But yes, we started with nutrition education promotion and programming. We have moved into physical activity promotion and programming. We also have incorporated policy systems and environmental changes. For example, we now provide funding and support to local organizations that are providing services to the populations that we serve. For example, right now we're working with low-income senior site apartments, and we provide funding and support to build a garden, community garden, that can produce food and vegetables and fruit for those residents living there. So that's an example of our policy systems and environmental change work. Other things that we worked around is doing a youth-led multimedia campaign around promotion of water consumption, right? We did that work with the city of Berkeley because they have the soda tax. So there, what we did, they provided funding and support for us to engage with a local high school and college, community college, to engage with their youth to make sure that they created some multimedia level campaign to promote consumption of water. So that's a systems change and environmental change that we did for them. So our program has grown tremendously. Our organization has grown tremendously, that at this point, we provide services and programming for anything that has to do related to health. And one of the new things for us is to provide trauma-informed nutrition education programming to those populations, which that's our new, so kind of moving into mental health work a little bit.
Yeah.
Our services are very broad, but it all has to be founded in, how can we promote wellness around nutrition, physical activity promotion, and also how can we improve and help with capacity building with our partners and organizations that are providing services to those populations that we are targeting. And most of them are at risk and vulnerable populations or hard to serve populations.
And could you tell us a little bit more about the trauma-informed nutrition program?
Yeah, that's our newest programming that we have had. So part of my doctorate, I received a doctorate in public health degree, and part of my research was to evaluate the effectiveness of a trauma-informed, the first of its kind, trauma-informed nutrition education curriculum called Around the Table that was created by Leah's Pantry, which is an organization that creates curriculum out of San Francisco. At the time, I wanted to work with mostly people of color, women population that are in a substance use disorder program and who are pregnant or just had a baby, so the perinatal population. So with that population, I wanted to do a nutrition education intervention and see if there was any results in changing behavior or food behavior. And so with that, I was able to obtain this brand new trauma-informed nutrition education curriculum from Leah's Pantry, which again, it hadn't even been published when I was, they were creating it and I was working with them to implement this intervention. And so I was able to reach out at that point in partnership with one of our community organizations, Fighting Back Partnership, to reach probably a total of 50 women who were in their substance use disorder program. And with Erica Orales, we were part of the wraparound services and we were providing the trauma-informed nutrition education program. So this curriculum is a 5 lessons curriculum where we go through different conversations. So nutrition education with trauma-informed practices is basically a type of conversation where we ask several questions. One of the questions is, what is a food that you can remember from childhood that brought you a lot of joy, and what type of food is that, and who prepared that food for you? And so a lot of the participants would have to go back to those early childhood memories around food and try to kind of talk about that. So we'll just have a conversation around, how did that make you feel? Do you still eat that food? Is that food bring you some kind of comfort when you're under a lot of toxic stress? Part of the curriculum is also talking about the different levels of stress, which amazingly enough, not a lot of people understand that there's 3 levels of stress. And there's the toxic stress, which is the one that we're trying to alleviate with a lot of this trauma-informed interventions. And so just to understand what is a normal level of stress, a sometimes necessary level of stress. For example, if you need to pay a bill, there's stress you have to pay that, but that makes you be responsible and pay. So there's different levels of stress. And so, but the toxic stress is the one that we're trying to alleviate and educate people around, because that's the one that can create body changes and kind of lead to chronic disease. It's
pretty incredible what you guys are doing with this nutrition program and really taking in toxic stress and being trauma informed. I mean, it's pretty interesting that you guys are doing it. It's incredible. If people wanted to get more information or learn more about the different programs you mentioned, or even this trauma informed nutrition program, how could they do that? Where can they go to find information?
So we have a website at www.innovativehealth.com. And then we have a Facebook page, Innovative Health. And then we also have an Instagram account, again, Innovative Health.
Awesome.
So we try to be very active in the social media platforms and our LinkedIn as well. And so, but I think that most people, if they just go to our website, we have a calendar of activities and events, and that they could, participate in our classes. They can see our offerings and where they're going to be. Again, we Innovative Health Solutions doesn't per se have offices. We provide services in several locations in Napa County, Solano County. And so that's important for people to know that if they want to go to a physical activity, a line dance class, just to go to our website and go on our calendar. And we have
Great.
offerings in different cities within, like I said, Napa County and Solano County right now.
Yeah, I'm looking at your calendar right now on your website, and it's great. I can see, that country line dancing you talked about. I can see, some of the other things that you mentioned, Latin line dancing. It looks like arthritis, stretching and strengthening for older adults. So it looks like you guys have some pretty cool things up here.
Yes, we do. And those are, like I said, our direct activities. And as you can see, we place them in different locations in the counties because that increases access for the population, right? Transportation is a huge barrier for a lot of our participants to attend or participate in programs in our communities. And so we try to locate our classes where they have easy access.
Yeah, it's great.
Amazing. And is there anything else that we didn't give you a chance to touch on that you wanted to talk about?
Yes, I just want to make sure that we relay the message that Innovative Health Solutions is really an organization that really works towards healthy and equitable communities for all people. And the way we do that is by playing a leadership to connect public, private, and government organizations to each other. So we try to build our partnerships. We are very, very intentional around partnership building because we know that we can't do, we want to save the world. Well, we can't do it alone, right?
Yeah.
It takes a village to do that. It takes a village to improve people's wellness physically, mentally. And so unless we connect with people like you guys, right, Torrey University, this program, we can't do the work that we do. We love to work in collaboration. That's our main goal, to collaborate with up to 3 different organizations to do something. I'll give you a perfect example. We do gardens, right? That's part of our policy systems and environmental work. Well, we have at the table, we have Sustainable Solano, right? What do? They build gardens, right? We don't want to go and start doing that. So we partner with the community right now in the community that's doing gardens. So we work with Sustainable Solano. We're working with a high school, Armio High, where they already have a garden and they already have the students. They already have the, in public health, we call it the captive audience, right? They already They have a garden, they have a student population. So we work with Armio High, Sustainable Solano to bring in that. And then on the side, we also work with another organization who's bringing the nutrition education and training for them. So at the table, there could be probably 4 organizations that we are working with to move forward this effort of increasing the education around food systems in the county, right? So I just want to make sure that people understand that we try to connect and collaborate and partner, and that's our main priority.
Yeah, absolutely. No, it's so important, as you mentioned. And then just for our last question, we just like to end on this question with all of our guests. But Norma, what is your favorite self-care technique?
Oh gosh, walking is my favorite. And specifically, I live in Benicia, so we have the Benicia State Park. So that's just the perfect environment to go for a walk. So I try to walk every morning, about 3.5 miles every morning whenever I can.
That's a great one.
Well, Norma, we just want to really thank you so much for joining us today and teaching us a little bit more about the services that you provide. To learn more about Innovative Health Solutions, check out the link in our post. And we also want to remind you, if you're looking for mental or emotional health resources and services, you can visit SolanoConnex, which is spelled CONNEX.org. Thank you.
Thank you both. This was being a pleasure. Thank you so much.